That was extremely important to us, that we not only tell the story from a data point of view, but that we tell the actual, like, real people stories, because that's what the point of this is. There's these names are of actual people who lived and died, and they have families, and they had lives, and they had relatives that were left behind.
I'm Justin Silverman of the New England First Amendment Coalition. A quick ask for all of you who support the First Amendment, open government, and local journalism. Please become a NEFAC sustaining member today. For just an annual payment of $50, less than $5 a month, you'll be helping not only our First Amendment education, advocacy, and defense, but you'll also be entitled to some really cool perks like exclusive access to our recent event with CNN's John King. We're looking for 25 new members between now and the end of the year. Please become one of them. Your support is crucial to the work that we do, and we're very grateful for all of your support throughout the year. Learn more and become a member at nefac.org/join. I'm here today with Keila Torres Ocasio of Hearst Connecticut Media Group. Keila, thank you for joining us.
Thank you for having me.
Keila, you and your colleagues at Hearst have done a fantastic job recently reporting on gun violence in Connecticut, specifically the number of gun deaths in the state over recent years. Can you summarize that work for us? Give us some of the takeaways.
Sure. So the project kind of started out with an 8-year-old boy who was shot and killed in New Haven. And we requested this information. We requested 10 years worth of gun death data from the medical examiner's office. And we looked through the data, and there were some things that weren't surprising, like the number of gun deaths in cities, our large cities, and especially of young people in the large cities. But then there were things that were surprising to us, like the number of older people who had died by suicide. That was something that I don't think any of us expected to see, that many people on that list who had died by suicide at those 70s, 80s, 90s. All of the people in their 90s on that list had died by suicide. So that was very surprising to us, and so those were some of the bigger takeaways from the project, and we were excited to be able to share this information with the public and try to let them know what was happening and what this information was saying to us.
Can you tell us a little bit more about the reporting? One thing that we like to do during these videos is to pull back the newsroom curtain, if you will, and really explain to the community how the reporting was done. I don't think all of the time and energy and money, the investment that the newsroom makes in this reporting, is as appreciated as it should be. So can you fill us in a little bit? What did the reporting look like? Where did you find this data? How did you go about getting the information for the series?
So the reporting started with that 8-year-old boy, and then Helen Bennett, the New Haven Register's managing editor, she's awesome. Helen is awesome, and she saw this child had been shot and killed, and she thought, well, we should get data on children who've been shot and killed. How many children have died by gun? And then she thought, you know what? Let me just ask for all of it. Let me just ask for all of the gun data. So she went to the medical examiners. Her team went to the medical examiner's office, and they requested 10 years worth from January 2010 to, it was about mid-August when they asked for it. The child died in early August. And actually, to his credit, the medical examiner gave the information within just a few weeks, which is almost unheard of in some cases, because sometimes it can take months to get information from state offices, and especially now during COVID, when a lot of state offices are saying, well, we're stretched, or there's people working from home, or it can be even harder to get information. But the medical examiner was amazing and gave us the information within a matter of weeks. And once we got this information, like I said, Helen Bennett, myself, and John Ferraro, our managing editor of news, we kind of sat down. We had a virtual meeting, and we looked at the information, and we kind of analyzed it, flipped it upside down, filtered it as many different ways as we could in our spreadsheet, And we found all of these kind of, amazing takeaways, like the elderly, or not elderly. It was a lot of older population. It wasn't just the elderly, who had died by suicide, and the young people in the cities. And so we knew that we had a lot of storytelling to do. And so we pulled together a team of 8 reporters, my team of 2 investigative members, and then reporters from the Connecticut Post and the New Haven Register. And we assigned them a whole lot of stories. We had 10 stories in total. And they went out there and they started asking questions of, state legislators. They started asking questions of mental health experts. They started asking questions of pretty much anyone and everyone they could think of that would be knowledgeable about these issues. And we had the hardest time that we had was finding families to talk to. We had this list of, thousands of, there was, I think, 2,056 names on the list. And so we knew who these people were, and so, but finding the people who would be willing to talk to us was not easy. And so it was much easier to find the families of young people who had died in cities. There were several mothers that we connected with who were more than happy to tell their stories, because they were like, this is a problem, and my child wouldn't have died if something had been done to prevent these kinds of crimes. And so there were, we had kind of very impactful stories of a mother who lost 2 sons to gun violence in New Haven. She lost them a year apart. We had, stories of a mother who lost her daughter to intimate partner violence. Her daughter's from Bethel, and she was killed in Bridgeport. But the hardest part for us was getting the information on an older person who had died by suicide. We made so many phone calls, just so many phone calls to people on that list. And it was kind of fascinating, the amount of people we reached out to, and the amount of people who just were like, we're not going to talk about this. Either there was a stigma that's attached to dying by suicide, or because they said, well, my family member didn't have mental health issues. They just wanted to die on their own terms. And so, we don't feel that that's something we want to talk to the rest of the world about. It was something very personal for them. And so, we talked to, I don't know how many people. We went to suicide prevention groups. We went to, just trying to find these older populations, these older people who had died by suicide. And it proved to be very, very difficult. And what we ended up doing was writing a separate story on how difficult it is to find these people, because sometimes they're not a matter of, it's not a matter of mental health issues. It's not a matter of what you would expect it to be. It's a matter of people kind of trying to die on their own terms. They have maybe dementia, and they don't want to get to the point where they lose all their, all their sense of self. And so we did a story just on that. What is that like? What can be done to help people who are in that kind of a situation? So that was, the reporting it took several months of reporting. And then of course there's the production side of it, where you spend all of this time and energy and, yes, money on trying to get the proper resources to tell the story in a way that makes it visually compelling to people, so that they can understand the impact of it. They understand the this is not just a regular project. It's not just a regular story. This is a series of stories about a very important issue. And we went through so many days of going through the every little detail of each story, going through every little detail of each graphic and interactive, and making sure the wording was correct. AP style, you do not say committed suicide. It's not a crime. You say died by suicide. And making sure every little I was dotted, T was crossed, to make sure that we were as sensitive to the fact that these are people's lives that we're writing about. These were people who were, impacted by gun violence, who were impacted by, death. They had lost a family member, and we're telling these stories. And And it was very important to us to be as, as careful and sensitive as possible in how we presented that information and told those stories.
Well, you did an excellent job, and credit to you and everyone else at
Thank
Hearst
you.
who is on this team. There are a number of things there I'd like to go back to, particularly who asks for public records and gets a timely response. Usually I'm having conversations hearing these public record battles about asking for information and having the responses be delayed and not getting information for months, sometimes even years at a time. But what a great thing to hear that you asked for 10 years worth of data and relatively quickly, and given the difficult circumstances that we're in,
Mhm.
that data was provided, which really, created the springboard for the entire series. And
Mhm.
it's great to hear that, in this case, that the public records law, worked as it was intended to. Can you speak a little bit more to public records generally within your work, and how important strong FOI laws are, specifically in Connecticut, where you're based?
Yeah, so I think you're absolutely right. We were shocked that we got the information that quickly because it never happens that fast. It just never does. And like I said, kudos to the medical examiner who gave us the information relatively quickly. I mean, just it was just a matter of weeks, and that was, it really it's how it's supposed to work. It's not supposed to take years to get information. That's not what the laws, are set up to do. And so, for us in our investigative work, it's very important that that these laws do work the way they should work, because otherwise, how do you tell these stories? How do you tell the stories of importance to people? How do you tell the stories that matter, that should maybe have there should be change, maybe, And so a lot of times it is very difficult. I have FOIs and with reporters that have, these reporters have put in FOIs that have been outstanding for over a year, of closed information, information that closed cases that should be readily available. There's nothing outstanding where there, is an open case, where there's something, going through court. There's nothing, it's closed files of closed cases that we've requested, and it's taken over a year to get them, and we still don't have them. That's more what we're used to seeing, is that kind of concern that we're not getting the information, that we're being blocked, or that it's taking so long to get the information, and you're not sure why. A lot of times you don't get status updates. You're not sure where it stands. You're not sure, if it's coming, at what point will it come. um, and so for us it's very important, the work that you guys do, and others, to try to prevent this from being like a given, that you're just going to expect it to take years to get information. It shouldn't take that long, and the FOI law is not written to take that long. And I think a lot of times government agencies need to be reminded of that.
Well, fortunately, in this case, you got the information, you got all of the data that you requested in a very timely manner. I think one of the things I appreciate the most about the reporting that went behind this series is that it wasn't just about the data; it was about all the stories behind the data. Particularly given the sensitive circumstances, the gun violence, the suicides, and anytime you're discussing gun violence, there's also a political component to this as well. So I think especially now, where unfortunately we're seeing a lot of anti-media sentiment in communities. How did you and your team go about seeking out those stories and convincing people to talk to you about these really difficult, delicate circumstances that they and their families found themselves in?
Yeah, so I think that was extremely important to us, that we not only tell the story from a data point of view, but that we tell the actual, like, real people stories, because that's what the point of this is. There's these names are of actual people who lived and died, and they have families, and they had lives, and they had relatives that were left behind, and so it was very important to us. The project wouldn't have worked if we had not had these stories. It just wouldn't have, and we wouldn't have, published if we had not had those stories. It was very important to us to tell the truth, from not only a data standpoint, but from an actual real life person standpoint who was left behind, who was, who lost their child, who lost their parent, who lost their spouse, who lost, it was important to tell those stories through that kind of lens. And so it was, luckily our reporters, like I said, we had reporters from the Connecticut Post and the New Haven Register, and both of those newsrooms are unfortunately more used to than the other newsrooms of covering, crimes, of covering, these homicides in their cities. New Haven and Bridgeport have, higher homicide rates than other cities, in Hartford as well, than other cities in Connecticut. And so they had contacts. They had, mothers who had lost their children, who had contacts of other mothers who had lost their children. It becomes like a network of people. When you lose a child to gun violence, I've learned you become a network with other mothers who've lost their children to gun violence, and people kind of gravitate toward each other, either because they want to do work to try to prevent this from happening to someone else's child, or because they find comfort in each other. And so, we had contacts of people in the community who knew people who were impacted by gun violence, or had, specifically themselves impacted by gun violence. Like I said, the deaths by suicide were a lot harder, and we didn't have those personal stories because they wouldn't talk to us. They wouldn't talk to us, and we did reach people. It wasn't that we couldn't reach people. We reached people, and they just declined to talk to us about it. And I think that's why it was important for us to address that in some way as well. So the stories tell you specifically, Hearst reached out to families, and they declined to speak to us, because it was important for us to let people know this is a sensitive subject. And because it is a sensitive subject, it's not easy to find people who are willing to speak about it. And that, I think, shows the importance of the subject as well, how, it becomes part of the story to tell the people this is not something that people want to talk about, and that's a problem. And that's, and maybe there's reasons for that, and that's where the story about, dying on your own terms kind of came from, because that was one of the things we kept hearing over and over again from people who didn't want to talk on the record. Were saying, this is why we don't want to talk on the record. They just wanted to die on their own terms. It wasn't, this is what happened, and we don't want to really, go into a decision that was theirs, that was that person's decision. And so it was important to us to tell that story from that point of view of, here are some experts who can talk to us about what people in that situation might be thinking, or might be going through, or might be feeling, and tell it that way, since we couldn't tell it from a personal point of view.
That's great. So you did all of this really important, challenging work. And I think the last thing you'd want is for it to fall on deaf ears. So what kind of reception have you been getting? Have people been listening? Have they been taking away the important messages in this reporting? Have, state legislators, for example, have they, created new initiatives, or have you caught their attention in some way where some, important change could occur because of the work that you did?
Yeah, so we spoke to several legislators after the stories were published, about, is this something that are these issues something that are going to come up in some kind of bill in the new legislative session? Is this something that there's something can be done about legislatively? And several legislators told us, especially the death by suicide. I think some of them were very surprised by that. And some legislators, like Will Haskell, said, this made me think. It made me stop and think about, we don't maybe think about this in terms of, the actual people who are affected by these numbers that we're, learning about all the time. And we, we do think that something should be done. And there were several bills that were already kind of in the works that they said, this kind of data, this kind of information being out there could help us, promote our bills, could help us, gives us the information that backs up what we're trying to do, which is always interesting, because you do these stories, and then you wonder kind of what will happen next. Will something change? What will change, if something will change? What could change? And you're never really doing it with something in mind. You're always doing it with like the sense of we have to tell the story that this data is telling us and the stories behind the data, but you're not really sure kind of how others are going to react to it or what kind of impact it actually will have. And so to hear that having this information out there could help with bills like the specifically one of the mothers actually spoke about this too in one of our stories, the bill that allows police officers to take guns away from people who may be at risk of hurting themselves or others. Right now there's a bill out there that would change the requirements for doing that for taking, and it would allow family members to be able to step in on behalf of people to say we think that they should, there are guns to be taken away. And it allows, it's right now, I think it's 2 officers and a state's attorney, and it would change that requirement. And it would just make it easier for guns to be taken away from people who might present a danger to themselves or others. And so to hear that our reporting might make it easier for someone to present a bill that would help protect someone from themselves or from others is a good feeling, because you wonder what your reporting will lead to, and to have it be something that this information is now out there and it might help lead to some kind of change that could protect people's lives is a big deal.
It definitely is, and I'm so glad to hear that the series is getting the attention that it deserves, and I hope more and more people will take notice, and ultimately it will lead to some significant change that will strengthen all of our communities. So, Keila, thank you again for all the work that you and your team did on this series. Really important reporting, and I encourage everyone to take a look for themselves and to see all of the great investigative reporting that Hearst Connecticut is doing. Keila, thank you again for your time. Much appreciated.
Thank you, Justin.